Hi, I did a podcast webinar, if you will, and I was able to talk to about 15 to 20 people from around the globe, and I was just trying to give them some advice, some help. One of the patients or people that wanted to be on the webinar, but they missed it, was William. So I just wanted to go over William's case, and I wish William all the best. But he basically contacted us with symptoms of inner ear pain, neck pain, tinnitus, ear fullness, chronic phlegm. What's very interesting about William's case is that he's seen everybody. He says he's had 4 prolotherapy visits. I would like to say that he hasn't been a patient of mine. He hasn't come to Caring Medical. And then basically he's had his eustachian tubes checked out. He's had lots of scopes, not much has shown there. Then he said he recently got x-rays of his neck and they weren't really that bad. So I just want to talk about what could be going on with William. And part of it is I wanted to do this case because, of course, not everybody's going to get better from prolotherapy, but let's be honest, it's just like surgeons, right? Not all surgeons are the same. Like what I would suggest William to do if he doesn't have access to coming here, let's just say he lives way, way far away, like let's just say he lives in Asia or he lives in England or something, it's not actually possible to come here, I'd really encourage him to get a CT venogram of the neck and head, because that may be the easiest thing to get, where you actually can see, is there some crazy compression of the carotid sheath? Because if there's crazy compression of the carotid sheath, William may have elongated styloids, right? He may have elongated styloids that the styloids need to be removed. This would show up on a CT venogram, right? That would also explain why, let's just say he got good prolotherapy, but there's something else causing the carotid sheath compression. The other thing that sometimes we see is that there's compression of the thoracic outlet. So the thoracic outlet is the space between the clavicle and the first rib. We have patients who, they may have a job where they have to put their arm out a lot, and they don't realize, like, every time they put their arm out a lot, it's compressing the thoracic outlet. Plus the way somebody sleeps, like in our office, we'll put somebody in a lot of different positions. So we make sure what is the position that William's sleeping in, that the jugular veins are open. If the jugular veins are open, it means that in that position, the vagus nerves aren't under any duress. You know, they're not under any stretch and compression. Because let's be honest, most of us would sleep like this, right? We would have our arm underneath us, and some people having their arm flexed, that can be enough to compress the veins that the jugular vein goes into. So I just put on here one of the things, oh yeah, he had ear fullness and he was having ear pain. I just wanted to put like all the different kind of conditions that can occur from jugular vein compression in the neck. It can cause all kinds of things: dizziness, sound sensitivity, muffled hearing, by mechanisms beside eustachian tube dysfunction. So in summary, I would obviously love to see how good William's cervical curve is, and I just have a feeling there's something else going on. You know, there's something in addition to maybe poor neck posture, and obviously it'd be nice to know he has clicking, popping, grinding in the neck, because, you know, I'll see some people, like I saw a young person who came in with his father, and he was obsessed with cracking his neck, like literally all the time cracking his neck. So obviously that kind of a person, I told them that it would be best that the son get over the cracking addiction, if you will, before you start prolotherapy. Because if you do prolotherapy and you're cracking your neck, right? William could have also had prolotherapy, right? But nobody told him to stop cracking his neck. And so, you know, that could be one reason why he didn't improve, but wish him all the best.